growing number of patients unaware they have HIV. A new drug to combat gastroesophageal reflux. And sleep deprivation putting junior doctors' health and performance at risk. Hello, I'm Stephen Marnie with the news from the Medical Channel. Research reveals that a large number of people are unaware that they have HIV. At the 20th Annual Forum for General Practitioners, organised by the Royal Society of Medicine, there's been a call for primary care professionals to encourage more people to be tested.
The week began with a look at sexual health, particularly HIV. Key speaker Dr. Patrick French, a leading clinician in the field, made a persuasive case for more HIV testing to take place in a primary care setting.
If you look at the number of people with HIV in the United Kingdom, you can tell from the anonymous seroprevalence studies that maybe a third, maybe more than a third of people with HIV are unaware of their HIV status. That means they can't access the treatment services we know would do them benefit. We also know that disproportionate numbers of these patients are people from communities that are relatively marginalised, such as, say, African communities, people who have recently arrived in the United Kingdom, and these people who are not attending health services in the same way. They don't tend to attend GU medicine clinics, they don't tend to put themselves forward for HIV testing. Knowledge around HIV issues is relatively low, but these people very much are attending primary health care. It's often families, often women with children. They are accessing primary health care, and so primary health care could be, in general practice, could be a place where HIV testing should be promoted and undertaken.
The good news in HIV care today is that combination therapies really do work. What needs to be done now is to ensure that all those with HIV do realise that they are positive, that they access the treatment, and that once on it, they stick to it. Emma Glasser, The Medical Channel.
The world's largest selling medication for gastroesophageal reflux, or GORD, is about to be overshadowed with the introduction of an alternative drug, esomeprazole. It's the latest in the current generation of PPIs, and it could help bring relief to approximately 8 million people.
Symptoms are caused when acid produced in the stomach is refluxed back up to the gullet, causing great discomfort in some 1 in 10 of the population.
It was debilitating in so much as you could learn to cope with it as best you could during the day with the antacids. But when you went to bed of a night, often the pain would happen when you were lying down, so maybe you wouldn't sleep as often. In those days we were on call as well and physically having to get out of bed. So the next day you'd be tired and maybe a touch irritable.
The new treatment binds to proton pumps in the stomach, blocking their acid production and lowering the acid in the stomach. Large trials have so far shown it to have clinical advantages over the current gold standard for gastroesophageal reflux, another PPI called omeprazole.
The first thing is that the blood level of esomeprazole is reached very, very quickly. Within an hour you reach the peak concentrations in the blood. This means you get very, very quick response to your symptoms. The symptoms will respond very quickly to the medication. The other thing is that by the very fact of its molecular structure, when it passes first time through the liver, it is not broken down as quickly as omeprazole, and so the blood levels remain higher.
Trials also show that it's 10% more likely than omeprazole to heal those reflux patients with esophagitis. NICE stated recently that the NHS is spending over £300 million a year on PPIs. Now, esomeprazole is the first and only PPI to be licensed to be used on demand. And as such, a lot of health economists are saying that it's cost-effective. Current guidelines suggest that in those reflux patients without esophagitis, esomeprazole could be prescribed with a 20 milligram dose PRM after symptoms have been stabilised. And that would cut the primary care bill for the condition from £18 to just over £6 a month. A rare example of synergy between cost and clinical effectiveness. Katie Whitaker, The Medical Channel.
Junior doctors' health and performance is put at risk by long working hours and lack of sleep. That's according to the BMA. It was responding to a new study that indicates too much work and not enough sleep slow responses as much as alcohol. The BMA says the study backs up concerns it's been voicing for some time. It's still the case that 1 in 3 work more than 56 hours in a 72-hour on-call period. Few GPs have any training in dealing with back pain. That's according to Dr. Peter Skew, himself a GP and an expert in musculoskeletal medicine. He's been widely reported as calling for health warnings for gardening programs. But he told me earlier that this was a tongue-in-cheek suggestion that masks some serious problems, not least for GPs.
we're only taught at undergraduate medical level those specialties that are in the hospital that are being serviced. Now, back pain and musculoskeletal disorders accounts for 50% of all work absent. There is no specialty to treat acute musculoskeletal disorders. Sports injuries, work-related upper limb disorder, back pain, all the aches and sprains that people suffer, and of course whiplash.
What would you suggest could be done to help GPs understand more about back pain and indeed increase training for them?
Well, there are training programs available through the British Institute of Musculoskeletal Medicine, and we have been lobbying the Specialist Training Authority for recognition of the specialty. The waiting list problem of 6 to 9 months for most specialties just doesn't cut the mustard with musculoskeletal disorders, because the pain created by musculoskeletal disorders becomes chronic in the first 3 months, and therefore the condition you have to treat changes from the acute phase into the chronic phase, and you only have this initial 3-month window to treat the condition before it changes completely.
You've been very successful in getting publicity by citing gardening programs as a major cause of back pain. Do you think that your real message actually got across?
Well, I hope so. By getting people interested in something and latching on to something that they're already interested in, you've got their attention. And if you can give them some serious factual knowledge to go with it, and something that will help them specifically, then I think your message will be taken up.
And still on the subject of therapeutic exercise, health professionals are being urged to measure patients' activity levels more accurately. Dr. Ashley Cooper, who's devised a machine to do this, says it's hard for doctors to advise patients unless they have an objective method of making measurements. This also means it's still unclear how much physical activity is needed for a significant impact on health.
We're told that there's a certain level of activity that we must achieve each day to gain certain health benefits, to protect from cardiovascular disease, development of obesity, things like this. The problem is that activity is measured usually by questionnaires. Self-report, they ask you how much activity you did in the past day or the past week. We think it's important to try and measure activity using much more objective measures, and we use small personal machines called accelerometers to do that.
At the age of 81, some people need care in the community or personal care from relatives. But 81-year-old Doris Barker looks after herself. More remarkably, she also looks after her mother, who's 104. Essex County Council has paid tribute to both women.
Victoria Henrietta Waite was in the limelight, and it was quite a day. There were photos. There was a local radio interview. There were cards and presents for a procession of well-wishers. And I dropped in to find out what it's like to be 104.
I can talk, I can think, but I can't do much. I can wiggle my toes, I can swear.
Oh! It's Doris that makes it possible for her mother to continue to stay in her own home in Chelmsford. But Doris is herself 81.
We get lots of support from Mid-Essex, social services, our friends, our neighbours. And as I've been trying to say, it truly is a communal effort.
Hello, Victoria. I've come to greet you on your 104th birthday.
A senior county councillor arrived to pay tribute to both women. Victoria Waite was born in the closing years of Queen Victoria's reign. She could scarcely have imagined that more than a century later she'd be cared for by her daughter, who was born just after the First World War. Essex County Council says it's important for people to continue to live in their own home.
We think it's extremely important. We think this is what people want. We're actually under consultation at the moment to get a strategy to make this possible in more instances than it is.
There were some things today that the birthday girl was not revealing. What's the secret of living to be more than 100?
Oh, saucy boy.
And finally, scientists at University College London say they've discovered why it's impossible to tickle yourself. Apparently it's because the brain's cerebellum spoils the fun by predicting the sensory consequences of the tickling movement. And that's it for the news for now. From all the team here, thanks for watching the Medical Channel, and we'll be back later.